This morning's health check, new medical technology is making it easier to treat premature babies by giving healthcare professionals a better view of a baby's veins before they're stuck with a needle. It may also be used one day for anyone who goes in for blood tests, donates blood, or needs IV treatment. Health Check reporter Christy Myers has the story.
Basically what it does is it's an infrared, near-infrared light that senses the hemoglobin.
It's called the Vein Viewer, and this new technology is making it easier to treat premature babies.
We can see if the vessel is still intact and if it's good.
It's hard to find the veins in a premature baby, and often they're stuck a number of times. But with this infrared light that looks kind of like a green-black light on the skin, it reveals the vessels as much as 1/4 of an inch below the skin.
It makes a difference because it allows us to see blood vessels that otherwise we wouldn't have access to.
That means less pain and fewer infections for baby and less stress for mom and dad.
You know, you don't want to see your newborn daughter stuck over and over and over with needles.
And with this, we are able to minimize it to 1 or 2 sticks at the most.
This infrared technology Vein Viewer was actually developed for children with cancer, but it's worked so well for the tiny babies in the neonatal intensive care unit, and it's now being tested in emergency rooms with both children and adults. Wendy Vasquez's newborn is hospitalized with an infection. She's happy baby Anthony won't have the pain that goes along with the extra needle sticks.
I think it's a great technology. I mean, to know that my baby's not going to get poked everywhere.
St. Joseph's is the first Houston hospital to get a Vein Viewer. It was bought originally for sick babies, but doctors predict many other uses for it.
In some, especially on the elderly, it will be very useful as well because their veins are very fragile, and of course they're more prone to infection as well.
And for Charles, whose baby Chloe was born at 27 weeks and weighs only 2 pounds, it's one less thing to worry about.
You thank God for all the technology because it helps her. Right, Chloe?
Christy Myers, 13 Health Check.